So some fun facts: 36% of pregnancies worldwide are actually unplanned. So you can see how important or how life-saving contraceptives and emergency contraceptives are in today's world. And today I'm going to talk about emergency contraceptives and why they fail. Hi guys, welcome. My name is Dorothy. I'm a community pharmacist, and if you're a new subscriber, you're so welcome. Please hit the subscribe button, like and comment. But if you're an old returnee, you guys are the real MVPs. Okay, a few weeks ago a lady came to me after she bought Lydia, and she complained that after she took it, she did a pregnancy test and it was positive. So the drug did not work for her, and she was so adamant that it was a brand we were selling and it was fake and everything. But then upon questioning, I realized that after she took the post pill, she thought it was a license to have multiple sex for 3 days, with the idea that the post pill offers, or you can take it within 72 hours. So then if I do take the post pill for 72 hours, I can have sex without using any form of protection. So there are two main types of emergency contraceptives. We have the copper IUD, which is an intrauterine device that's inserted into the uterus to prevent pregnancies. Basically, it's the most effective. It's, according to the WHO, is more than 99% effective. And then we have the oral emergency contraceptives, which are tablets that are ingested, are taken by mouth. And examples are the levonorgestrel found in Lydia, Postinor 2, Levon 2. We have the ulipristal acetate found in Ella1. And we have another method that basically uses combined oral contraceptives, which are pills made up of both estrogen and progesterone, and taken in certain strengths at certain times. But then this is only done under the supervision of a health professional, right? So according to the WHO, the oral contraceptives, the main two groups, which is the levonorgestrel and the ulipristal acetate, confer a pregnancy risk of 1.2 to 2.1 and 1.2% respectively. If the post pills are this effective, why are some people still getting pregnant when they take them? So the first point is this: timing. The most important thing about taking a post pill is taking at the right time. So emergency contraceptives work by delaying ovulation, and an added benefit is that if you've already ovulated, they prevent the sperm from fertilizing the egg, right? And they are, according to the WHO, they are most effective when taken within 24 hours after having unprotected sex. Taken within 24 hours, they confer a protection of about 95%, but if taken after 24 hours, that is within the 48 to 72 hours range, it drops from 95% effectiveness to 58% effectiveness. That means you are at higher risk of getting pregnant taking 24 hours after unprotected sex, right? So the sooner the better, basically. People think post pills are like a sexual free out of jail card, right? They think it's a license to have more sex, but that is like the worst lie anyone could ever tell you. If you do have sex within the first 24 hours of taking a post pill, you do not need to repeat it. However, if you have sex after the first 24 hours, you do need to repeat the post pill. The lifespan of the sperm is about 3 to 5 days, and as you can tell, it can outlive the benefits that the post pill confers. Hence, if your post pill is giving you protection within 72 hours and there's a sperm lurking around somewhere that's living for like 5 days, that means after the 72 hour you could get pregnant if you do have sex after the first 24 hours from taking your first post pill, and especially if you do not repeat a post pill. Now, your BMI is very important when selecting an emergency contraceptive, because research has shown that for ladies with a BMI greater than 25, you have a reduced effectiveness when you take an emergency contraceptive. Now note this, I said it's less effective, not ineffective. That means it does confer an amount of protection, but compared to a normal size person, the effectiveness is reduced. This is because for obese people, the absorption and distribution of the drug is reduced. Hence, you have a lower concentration or lower amount of the drug in your system compared to a normal sized person. So if you are obese and you need an emergency contraceptive, you might have to talk to your doctor or your pharmacist about other contraceptive methods, which you could either add, apply the condom, or completely change your contraceptive method that is better suited to you. Okay. One main side effect of a post pill is that it causes nausea and vomiting. So if you do vomit between 2 to 3 hours of taking an emergency contraceptive or a post pill, you do need to repeat it. Also, if you have digestion issues, you're running or you have diarrhea, immediately go to the washroom after taking it. There's a high chance that the drug wasn't absorbed, so then you might need to repeat your post pill. Drugs interact. Interaction being that another drug can affect the absorption, the distribution, the excretion of another drug in your body, making it less effective. The same applies to emergency contraceptives. So medications such as rifampicin, used to treat tuberculosis, phenytoin, carbamazepine, used for the treatment of seizures, rhizofolvin, which is a common antifungal drug used for fungal infections, and herbal medications can prevent your emergency contraceptive from being absorbed, distributed, or increases how fast it's excreted in your body. So then you not have the medication in the right amount in your blood for it to work as effectively as it should. So whenever you're taking your emergency contraceptives with these other medications, especially herbal medications, because I see a lot of people come into the pharmacy, they're taking emergency contraceptives and they're taking something like Tinacet Venicare together at the same time. It might not work. You need to take them 2 hours apart, or you need to talk to your pharmacist to help you structure how to take your medications. Right. Thank you guys so much for watching, for the support in the comments and the likes. I really appreciate it. It really keeps me going, like legit keeps me going. Please do that. See you guys next time. It's gonna be a fun time the next time. Hey.